So welcome everybody to this edition of My Macular and Me. I'm Emma Malcolm and I look after our services and fundraising here at the Macular Society, and I'm going to attempt to take over from Kathy Yelf, who retired last month, for those of you who joined us. We're talking today about home monitoring between appointments for patients with AMD, and are joined by Dr. Stephanie Campbell, CEO and founder, Pranay Docker, data lead, and Sally Van Hofsten, product manager at OKKO Health, who many of you may know we've been working with for quite some time now, helping their team to understand the impact that macular disease has on your day-to-day lives and what's important to you, so that as they develop their home monitoring app, they're able to keep this front of mind. They're also joined today by Professor Alexander Foss, consultant ophthalmologist and honorary professor at the Queen's Medical Centre, Nottingham, and Professor Susan Downs, professor of ophthalmology at the University of Oxford. Please do feel free to post any questions at any time for them in the chat box. We're going to talk, I think, for about half an hour, and then we'll have a really good half an hour for questions. In the meantime, I'm going to hand you over to Stephanie.
Thank you very much, and welcome to everybody who's joined us for this webinar. I'm so delighted to be able to feed back to you some of the fantastic work that's been going on over the last couple of years in this joint project between the Macular Society, Nottingham Hospital, and Oxford as well. And also, I just want to say a huge thank you to Innovate UK, who funded this project. It's a really special project because we understand it's the first patient-driven AI in ophthalmology. And you're going to hear a lot more about that from my colleagues throughout the evening, and why it's so important. And I want to say a huge thank you to those of you on the call and those of you not on the call who have been contributing towards this really important piece of work. So I'm going to pass over now to my colleague Pranay, who's going to take you through the next steps.
Thank you, Steph. Just as a quick introduction, I'm our data lead at OKKO Health, and talking a little bit about today about what is the AI study and what are the results so far, and just giving you a bit of an insight into what artificial intelligence is, where you might have seen it before, and how we're using it at OKKO to improve your lives. So what is artificial intelligence? It refers to the capability of computers to appear to think, reason, learn things, and make decisions, with the outcome being some form of benefit or an enhancement into the way we do day-to-day things. So what exactly is the AI study? So it is as Stephanie mentioned, an Innovate UK grant-run study, which is partnered with OKKO Health, the Macular Society, the Oxford University Hospital, and Nottingham University Hospital. We've got over 200 people sort of running within this study between the two university sites. And what we're hoping to do with our application, which is a mobile-based games which you play on your phone, is to build an AI algorithm which we can then use to pick up changes in vision. Ultimately, we're hoping that what this can do is ensure patients can be seen sooner if their vision appears to be getting worse. This slide basically is showing where do we do predictions in other places. So there are two graphs on the screen here. The top one is showing a stock market graph, and it basically tells there are points within the graph which tell a person to either buy or sell. So there is some signal that happens across time to tell people, oh, you need to buy a stock or you need to sell the stock, because we can predict that the price is about to change. And then there's another example below, which shows a seismograph. So looking at is what is happening relevant to the Earth to detect is an earthquake about to happen. And there's a squiggly line which gradually gets a little bit bigger, which we can determine that there is some form of warning that an earthquake is about to happen, which means we can, tell people that, earthquake's potentially about to happen, brace for impact. So yeah, just a couple of examples there. And so what I'm going to next go into, if you could go to the next slide, Sally, thank you, is how do we do this at OKKO Health? So this is a sort of step process initially, but the first 4 steps is really understanding what happens when you go to the clinic and get seen for the eye conditions that you have. The first step is we would like to sort of ensure that you've had your OCT scans taken. So this is just an image of an OCT scan. So those big machines that you sort of put your head into and get pictures done of the back of your eye, which then spits out an image that a clinician can look at to sort of look at the image of the back of your eye. What we are then able to do is have expert clinicians to then mark on the graphs, mark on those images where there is presence of different types of things. So on this image, there are a couple of different things on here called epiretinal membrane and drusen, which are as just examples of things that can be spotted within an OCT scan. And we do this across all of the different sort of OCT scans that we've got. I think we've got over sort of 750 scans at this point, and just many more while we're still going through this process. So then what we are looking to then do is determine what do the clinicians do once they see these graded images, and can we follow some form of flow chart that we can basically determine has something happened within the prior to the visit, close to the visit, which would determine a clinical event, which is basically something that's happened within your eye that has changed to basically say, we need to capture this as soon as possible so that we can prevent any vision getting worse. So an example being here is maybe an image shows that there has been new fluid introduced. And if that has been introduced, then we would want to capture that as a fluid clinical event so that we can say something's happened, we would want to capture this as soon as possible. What this eventually means is that we can basically build a database of all the clinical events that have happened based on your visits to the clinic. So for everyone that's sort of as part of the study, we can take down when they've visited, if they've had any of these many different types of events. So an example here is fluid. There's one for cataracts. There's new cataracts. There's some for a number of other things, and we've basically been able to determine a number of events that have happened across time, which we can then compare against using the game data that we've got that from the participants who are also playing between their visits, which is super important. So yeah, just a small insight into what we've got so far. We've got over 65,000 games played in the study by over the 200 people that are sort of taking part. So just a massive thank you for the continued engagement of the participants there. So that's about 3 sessions played per week, which is sort of our recommended number to give us an indication of we can sort of see vision changes sort of week on week, month on month, and between visits. And what we're hoping to do there is really look at that information and start to make predictions on does vision look to be changing based on those results. So I think this is my sort of final slide, but just keep everybody who is sort of already playing and anyone else that is sort of interested in playing is just keep playing. You're doing a really great job. We're able to sort of detect clinical events as they happen now, which is a really exciting proposition. The next step is, as I mentioned, being able to predict clinical events before they happen so that we can intervene as soon as possible. And so the more data we have, the more accurate we can be with these predictions and the better outcomes that we can sort of ensure in the long run. Thank you so much. And I believe I am passing back to Stephanie.
Oh, thank you very much. And for those of you, I think probably many of you on this chat already play our games, but perhaps there's some of you who don't. For those of you who don't currently play our games, we're going to just share a little image of those as well so that you can see this. But in the meantime, we'll just tell you how they work. So we've got we've got an app that puts lots of spots on the screen, and these spots, these are circles that are different sizes, so just like the eye chart. And so if you have a look here, you'll see that on the left hand side we've got, hopefully everybody can see my screen, on the left hand side you can see circles that are different sizes. So just like the eye chart, some of these are easier to see and some of these are much harder to see. And what's happening here, as you click on the different circles that appear, they disappear. And there's some nice music. It's much more exciting than the slide that I'm showing you. And what we look at is how many are you able to see that are big, and how many are you able to see that are smaller, and everything in between. And that's what allows us to measure the visual acuity. So this is similar to in design to how it's measured on the eye chart. The other thing that we measure is something called distortion, which is how, about the clarity of the vision. So many of you might be familiar with the Amsler grid. Hopefully most of you know what that is, with like a grid, and it's got black and white grid basically that you use each eye separately to look at and see if there's distortion in your vision. So what we've done is we've got a similar concept here. There's a ring of dots, and one of those dots is sitting outside the circle. At any one time, only one dot is sitting outside the circle, and that's the one that you have to click on. However, if your vision is naturally a bit distorted through AMD, it's more difficult for you to pick out that spot. So what we're looking at here is, what is the reaction time, and how many mistakes are you making before you click on that spot? So I'll stop and pass back to my colleagues. So I know that will be very familiar to some of you on the call, but for those of you for whom it's new, perhaps this is something that you're going to be using in the future. Thank you.
Hi, I'm Professor Alexander Foss. I'm a consultant ophthalmologist based at the Queen's Medical Centre in Nottingham, and I'm a lead clinician for the Macular service. Susan?
So, I am also Professor of Ophthalmology, and I am in the Medical Retina Service as a specialist in AMD.
So the next couple of slides is to explain a little bit about the background leading up to this project. The problem can really be summarized in one word: workload.
So what Alex is referring to is the problem that we have to provide the service in the UK, because the hospitals have many, many outpatients. And if we look at it, there are 750,000 individuals affected by some form of AMD in the UK. And that's over 200 million worldwide. And if we separate out those cases that are relevant for wet AMD, then there are 40,000 new cases per year. And trying to distinguish the different types is really important, because those that have wet AMD have an urgent priority for treatment. So we need to be able to identify them. Also, in the system, we have many patients who are undergoing regular injections, and it's important that we monitor them in a way that the hospital keeps an eye on things, but also it's a situation we arrive at where some patients get to the point where they don't need such active monitoring, or they may have long gaps between treatment, but we can't keep bringing them back for imaging if they're not active. So this may be a way forward, and this project is very interesting and exciting for us, as it may be a way of monitoring individuals between these imaging and face-to-face appointments.
So this slide shows a couple of graphs. The key point is the trend that's going upwards as you go to the right. The number of cases has increased dramatically over time and is still increasing. So the last 4 years alone, there's been a 12% increase in the number of cases, or a 3% increase each year, every year. The increase in workload is not just due to increasing numbers, but is compounded by advances in treatment. Medication is delivered by intraocular injection, which is a hospital-based procedure. This workload, as we look at the next slide, please, is increasing at an even faster rate of 10% per year. The weekly number of injections has increased in Nottingham from 75 per week in 2012 to now touching 200 per week. And the blue part of the curve is the future prediction, showing that this trend is set to continue. That small dip around 2020, for those interested, it was due to COVID.
So we have a similar issue in Oxford. Next slide, please. And we also are seeing that we need to do 200 plus injections a week for AMD. In addition to that, we're doing injections for vein occlusions, diabetic retinopathy. So this is a large, very busy service. And like Nottingham, we've had to put on extra clinics in order to be able to provide this service. So what's the solution? One of the approaches has been to develop virtual clinics where individuals come, have their imaging done, and then they're contacted after the imaging to say whether or not they require further injections or the gap between can be extended, which is the extended appointments. And also we now have longer acting drugs. They don't work for everybody, and we hope in the future there will be more things coming online, but these are the mainstay now of trying to manage the increasing workload. However, introducing virtual clinics, extending appointments, etc., have their own issues. Some patients have limited contact with doctors and they want to ask different questions, not necessarily all related to AMD. They may be about, do I need my cataract done? Is it time for updating my spectacles? There's also an increased anxiety between the extended intervals. So in those gaps, it may be that some individuals notice a change in their vision and they're not sure whether that's relevant or whether they ought to request another appointment. And part of this study, we're hoping, will enable us to be able to tell whether this app has the ability to enable us to know if there is a real issue between if someone develops symptoms, if the game isn't being played in the way it should be, in the sense of seeing the dots, then is that the time that we need to have another look at them and see if they need a further injection? And the other concern is that the patient's voice is at risk of being lost.
So the aim of this app is several-fold. It gives the ability to monitor symptoms, ability to test vision, with the AI component, hopefully to be able to detect whether disease has become active and requires attention or whether things are stable and can be left. The app would also give the ability, in a sense, to mirror the clinical notes. People like traveling around, so it makes it much easier if you're moving around to have a version of what's happened to you with you. And also, we'd like it to provide an educational resource for good quality information for using the app to compensate for the lack of contact time with doctors. So this leads to the concept of the expert patient. So this slide has a number of buzzwords on it. The expert patient, who's described as educated, equipped, empowered, and enabled. Although these are buzzwords, the intent behind this is very serious. While this is early days, and the situation is clearly going to evolve, it's all about giving patients a chance to be more directly involved in the management of their condition. Back to Stephanie.
Oh, thank you. We put this slide up here because we all believe, this team together believe that eye care is better when it's in everybody's hands. And that was the reason why I started OKKO 5 years ago. Sally and I have been working together that long, but also because we really believe that technology needs to be driven by patients and people like yourselves first and foremost. That there's no point in technology companies and hospitals designing new ways of doing things if we don't have our people who live with eye disease at the very, very center of it. And that was something that we wanted to do. We said, well, okay, if we keep bringing in patients into clinic to always measure their vision, you know, that isn't necessarily going to help us, and it's not necessarily going to help patients who need to come in a lot. So if we can safely keep folk away from clinic when they're happy to do so, but also fast track folk in at the earliest sign of deterioration, this could end up being much, much better for everyone. So that's very much at the center of this project. And so the data that comes through every time that you click on the screen in the app, that data is being used. Pranay's team are using that data in order to create this algorithm to detect change at the earliest possible opportunity.
Brilliant. Thank you, everybody. That's a whistle-stop tour through through the project. We're starting to get some questions from people in terms of how do they get to be part of this. So if anybody's with us this evening, can anybody join? Is it how do you, if you're not already part of this, how do you become part of this?
Well, I'm going to pass over to Sally to tell you a little bit more about a research group that we have on through the Macular Society, because what's been happening over the last year and a half, I think, Alex and Susan, if you've been a patient at Nottingham and Oxford, you've been able to many of you will have been invited to use the app on that basis, and have been playing it, perhaps 3 times a week. But what we also have, especially for Macular Society, for Macular Society members, is that we've been running for quite a few years now a R&D group, a research and design group of folk who've been specially consented to use this app and help us make it better over time. And that's not just for people who have macular degeneration, but there may be other conditions there as well. And what that allows our team to do is to learn from people who have other conditions. Well, what does the pattern of data look like coming through? And so for some of you, there are some eye conditions that are not suitable for use for the app at the moment, or rather the app isn't suitable for everything at the moment. So for example, if your vision is particularly impacted by your eye condition, and maybe you're struggling to read the first couple of letters on the eye chart, for those patients, it may also be very difficult to use the app. But for patients who have got a smartphone and use that smartphone regularly, it is possible for you. If you email support@okkohealth.com, we'll pop that in the chat. Oh, it's on the screen as well. You can email us, and Sally and her team will be able to work through and understand if the app is suitable for yourself. So I'll pass over to Sally to tell you a little bit more, because I think many of you may know Sally, and you can now put a face to the name as well.
Absolutely. Hello, everyone. Just to quickly introduce myself again. My name is Sally, and I'm the product owner at OKKO Health. And I've been at OKKO since 2019, and in 2020, Stephanie and our team and I decided that we wanted to learn more from people living with this condition, and to do so we had to start this sort of internal research and development, or research and design group, and the whole idea of that is to speak to people such as yourselves throughout our development, and ensure that anything that we build, design goes through you all, and making sure that if we design anything new, if the app is changing or upgrading, we're sense checking it with people living with a macular condition or similar conditions. And so if you're interested in joining this group, this internal sort of research and development group, then I believe Stephanie has added into the chat the support email, and also on the screen here you can see support@okkohealth.com. So if you send an email to that email address, we'll do our best to get back to you as soon as we can. We have a lot of requests coming through at the moment, because I think we quite recently put something out through Macular Society e-newsletter, which is incredibly effective, because a lot of people are interested as a result of that. But we're getting to you as quickly as we can, and we would love to have you part of our internal research and development group. So we look forward to speaking more to you.
Yeah. I mean, somebody's posted a question in the chat, which I know that Stephanie's going to answer, about that contact with a doctor. And I suppose, Alexander and Susan, there is something, isn't there, in that it gives people confidence knowing that I'm speaking to an expert, and there's a balance, isn't there, between, we know that there are huge pressures on the NHS in terms of staff, particularly with eye care. We know there's this huge workforce shortage. So how do we ensure that we get the balance right between these fantastic tools that are coming through, but they're not feeling like, oh, I don't ever get a chance to talk to somebody face to face who knows what I'm going through? How do we ensure that balance?
Well, it's difficult as the first observation. The full concept of expert patient, the patients themselves become experts who can help other patients understand their condition. Now that's a little way off yet, but that, in my head, is one direction to travel. Susan, what are your thoughts?
Well, I completely agree with the issue about not being able to speak directly with somebody. And I don't see this app as utterly replacing that. The system as it is, I see it more, and correct me if I'm wrong, OKKO, team, but I see it more as helping us alert to an issue, for example, a drop in vision, where you get back into contact with the hospital, and somebody wrote in the chat about the possibility of it being available in the community at the optometrist. And that may be an avenue to explore, which would be for new patients developing distortion or visual changes. It might be something that could be used in that situation, but I slightly digress there. So I think I totally understand the issue about not being able to see a doctor or a professional who is experienced in the field face to face. But I think if we can build these sort of things in to ease the system for those patients who don't need the regular input, who require more of the, for example, someone who needs intermittent injections, but their gap between injections may be up to 3 months sometimes, to have this app to check their vision. If we show that the study shows that it is adequate to do that and comparable to the OCT scans that Pranay was explaining about, and if it does show that, then it will help free up those slots if we don't have them these individuals coming back for more frequent scans, if we can use this as an alternative. So I'm not saying it will get rid of doctors or face-to-face, but it may free up some spaces for those who do need a face-to-face.
Well, also, presumably, it means that patients, we know for some patients, they're having to travel quite long distances to go and have their appointments. And actually anything that we can do that can give you as a patient the confidence that actually, okay, this is telling me I don't actually need to see my consultant at the moment. We get calls from people going, I haven't, I'm meant to have had an appointment 3 weeks ago. I've heard nothing from the hospital. I'm really worried. Actually, this could give them some reassurance, couldn't it? That actually, okay, the app isn't telling me that anything has changed actually, so I can feel confident in the fact that I don't need to go and have another injection for X amount of time.
But we will have to show, in response to that, we will have to show that this is the case.
Yeah.
This is what this study is all about, is to give us confidence that for those individuals who are self-monitoring with it, in the same way in the old days as people used to monitor with an Amsler grid that Stephanie mentioned earlier, that it is adequate and that it can pick up if something changes.
And horrible question, and I don't know who's going to answer this, but when might we know definitively for everyone on the call, and then anybody, all of those people that we know are going to be diagnosed from now into the future, what are we talking? Are we talking a year, 2 years, 5 years? When might we know that this works?
Well, I mean, it's the number of issues there. It also depends on the subgroup of patients we're looking for.
Okay.
So some people, for example, who've had course of treatment have not had injections for over 2 years, and the hospital wants to discharge them, and just as you say, they'll like some reassurance that there's something. We're looking at the moment that the patients will undergo active treatment. Can we successfully predict those who need treatment who are deteriorating versus those who could be stably watched? Preliminary results hopefully will come out next year, but there will be preliminary results. And this is going to be, it's likely to evolve. Improvements will come in as you get the results. You think, we can do better, etc., etc., etc. So, to some extent, it'll always be work in progress.
Yeah, well, that is AI, isn't it? I mean, it's changing so rapidly. I mean, there's been talk, haven't there, recently about, I think, they're using AI now to look at breast cancer scans because they think actually the AI is much more accurate at picking up some of those cancerous cells than a human being would be. So presumably, as the technology gets more advanced, there is so much more possible with this.
Can I answer that? One thing I would say is that there are some really superb aspects to AI that could be very helpful. You're going more into imaging and reading of imaging and using AI to read images, which does have a significant place in ophthalmology and is being explored as we speak. This, if we take a step back, is about whether the app at the moment, as Alex pointed out very sensibly, is we're looking at it in a very specific field at the moment. Is it fit for purpose for expanding it out to everybody as I discussed earlier, with putting it in, for example, in an optometry shop in a window, and somebody could look at it and, I don't know, with a touch screen or something, look at it and check their vision. That's yet to be shown.
Yeah.
This study is looking at those in treatment at the moment. And it may well be, Stephanie will say, they may well want to look at other conditions like vein occlusions, diabetic maculopathy, lots of other things to think about. But I think for the app, it's more along the lines of analysis of its use in the context that we've described. And your reference to AI for looking at images was also extremely exciting.
Yeah. So remind everyone who's listening, who is the group of patients that at the moment are using the app? So for anyone, because there's quite a few people who are here who aren't part of it yet. So if I want to take part in this, what is that criteria, Stephanie?
Thank you. Yeah, so if you have macular degeneration and you're able to see that first few lines on the eye chart in at least one eye, then please email us and get in touch, because if you're a Macular Society member, we may be able to get you onto our research and development group. It is only for people who are already under the care or regular care of an ophthalmologist in a hospital or an optometrist in the community. So that's important. The main thing we say, because this technology is very much still work in progress, we want people who are regularly seeing an eye professional, so that if they have any problems and if the app doesn't pick that up,
Yeah, that
they're still under good care. Yeah,
Brilliant.
absolutely.
Brilliant.
So, but there might be people on this call who, and I know at least one on the call who, has got diabetic eye disease, and if that's the case, or vein occlusion or something like this, then you know what, I just want to see if this works. We're able to, with consent, we're able to take you on to our research and design study as well. And actually a really interesting part of this work that's been done. So I think I just want to have a look to see whose question it was it Dave? There was a question somebody asked about contrast sensitivity, and who was that? Let's have a look. Yep, so there was somebody who asked about contrast sensitivity. So we used to have 3 games on the app: one for visual acuity that I showed you, one for distortion, which I showed you, and another one for contrast sensitivity, which is about, how well do you see in dim lighting conditions. And we used to have a game that had lots of bubbles floating around. Some bubbles were darker, easier to see, and some bubbles were very faint. And you had to click on all the bubbles that you could see. And we actually took that one. We've temporarily taken out. I'm so sorry to for the person who put this in the chat, for whom they felt that was the most useful one. And the reason for that, who was that? It wasn't Dave, was it?
Dave.
Was it Dave? I'm so sorry. For 95% of people, it wasn't useful. More than 95% of people. I think we had about 3 people for whom it was useful. What we found out was that in macular degeneration, contrast sensitivity is definitely impacted. And when we take a group of people who have macular degeneration and we take a group of people who don't, there is a difference in the average contrast sensitivity between the groups. However, and I'm so sorry about this, but at an individual level, it wasn't showing anything significant. And the one thing we didn't want to do at OKKO was to spend loads of time, getting you as our guinea pig, spending loads of time doing this contrast sensitivity test every week if it wasn't going to give really useful information. So that was the reason why we turned it off. However, then that was for macular degeneration. What we did find, although we turned it off for everybody temporarily, what we did find is that if you had different eye conditions, it was useful, and that was outside of macular degeneration. So please do get in touch with us if it's something, because we may be able to put you on a separate group and put it back in. Because what we have, there's been a group in India who've used our app for screening children's vision to see whether or not the vision's normal or not, and they found that the contrast sensitivity was very useful for that group of young children. So the idea behind OKKO is that we measure vision, but if you have a particular eye disease, we're measuring certain things, and then if you're at risk of a different eye disease, that we measure other things. So imagine like a pizza with different toppings. You know, what we want to ultimately do is to make this available, so that if your condition is, you know, diabetic eye disease, that you have the toppings that are relevant in the games that are relevant to diabetic eye disease, for example, or glaucoma. Somebody's asked about glaucoma, and I wanted to let you know that we have started some work, some very early work on glaucoma. And oh, it was Dave. Yeah, so you were just saying, yes, the contrast game is most useful when driving in bright and poor light. I mean, I hope you're not doing it when you're driving. I hope that means you're doing it at home. But yeah, so do get in touch with us, because we may be able to switch it back on for you. But the reason we won't switch it back on for everybody with macular degeneration is because that data wasn't useful. And I think that's the really cool thing about this exploratory side. And Pranay is doing the same when he's looking at all the data about, and Pranay, you may want to jump in here if you like, the data about how many, you know, we've got quite a few hypotheses or ideas of things that we think may be relevant to the vision. And for example, how many mistakes do people make? Is that relevant? Pranay's team are looking at that. Or because at the moment, if you think about the eye chart, what we focused on to date is how many lines can you read? And everything's been about that. Whereas actually, because this app is designed in such a way, we're able even to look at how far you are away from the screen. And does that change? Is that an early indicator? So very much that's what we're focused on. What are the early indicators? So when we turn things on and off, it's either because there's been a request, you know, feedback or data feedback as well.
We have a colleague with Stargardt, and for him the contrast is so important. He really struggles in very high or very low light. So yeah, it may be that there are other macular conditions for whom actually that's way more appropriate. Alexandra and Susan,
Yeah.
I'm interested because you talked about the expert patient, and somebody's put a question in the chat about the fact that often what you're told in these appointments is ridiculously complicated. You possibly don't understand. So how much is there in the app that will kind of talk you through some of this stuff that you might be being told by your consultant? Because you said, didn't you, there's information as well in the app. So how much of that is helping patients?
Alex, can you speak to that first?
Yes, I'm afraid I'm probably guilty as anyone of that particular problem. Let's be clear about that. And certainly our letters we walk out to patients are written in doctor speak, often full of abbreviations. So one of the things that is an issue we do want to address, have a good glossary of abbreviations, so that you get this letter, you may be able to decipher what it means. Hopefully I send a copy to your society for vetting. If not, I will do so shortly. And then Susan and I are planning to do a series of podcasts where we try to explain things. And one of the problems is getting the level right when you try to speak.
Yeah.
Certainly I'm guilty of often pitching things at a level that's not too high. And this way, where your society will come into it, because we expect your society to vet the videos and give us feedback, and we're prepared to re-record them until we get it right.
I had a researcher who told me once that what he tries to do whenever he's talking about his research is imagine he's trying to explain it to his 3 or 4-year-old niece or nephew, and that is pretty much, if you can get them to understand, you can get anybody to understand. So I don't know how helpful that is, but yeah, I think anything that is very, very simple. It's such a complex, isn't it, condition, and it affects everybody so differently, that anything we can do that makes it so much easier to navigate through some of this stuff that we're being told is really helpful, and will ensure that patients do feel confident that they know what it is they have, what the effect is, what they can do to make life easier living with it. So yeah, well, we would love to help you with that, most definitely.
So
there's a
I can say something there as well. I completely agree with Alex, and the whole plan is to cover some main topics, cover some topics that come up regularly. So one about what the condition is, what the different types are, because even just to say right now, you know, there are, for example, there are some genetic predisposition for these conditions, as in the AMD conditions, and that immediately takes us off into, okay, genetics, now what are you talking about?
Yes.
So everything, and then you might say, right, well, there are some new therapies out there that might be gene therapy, but you've got to have understanding of the genetics first.
Yeah.
So everybody is different. Some people want to have the information at couched in a certain way. Others want the real basic science. So it's a real variable feast as to how you deliver the information, and sometimes we don't get it right. So we hope that with this app that we can cover off some of these more basic issues about, you know, what to expect from treatment, and many of us deliver information leaflets about that, but what to expect from treatment, what is the condition, what's the long-term prognosis, can I expect, what happens with driving, all the things that are of importance. But in addition to that, we're hoping also to talk a little bit about what happens in the future, what's coming online, and how relevant are these research projects that are going on, because I think people really want to know about these things.
They really do. And I suppose that was going to be my other question to both of you, actually, is what is your hope in terms of this and where it might lead? And, you know, what would you love to see happening and changing and improving over the next kind of 3-5 years for patients with AMD? What's your dream?
Sorry to interrupt. One of the first things I can say, if I can chip in straight away, is I would really like to see something that we pick up early AMD, as in not early AMD where there are just drusen changes, so early features. I would like to pick up when it's just starting to become wet, because so if this were available for people in the general domain, we might get people earlier, because one of the things I've noticed over the years doing this, and that's quite a lot of years, as Alex will testify, is that we get people late. And we really would like to get them earlier. So not only would I like to see it being useful in self-monitoring in long gaps after treatment, even if treatment is stopped, and it's helpful to check yourself to see if you've had a reactivation, which some people get, but also in early disease, as in the beginnings of wet AMD, so that we can catch people in good time.
Yeah. I think that's what we want as well. You know, we get calls from people who, by the time they noticed anything was wrong, you know, there was so much less that could be done. So anything that we can also do to help people understand, you know, what can go wrong in the eye and what you need to be thinking of, and going and getting your eyes tested, you know, is so important that we look after our eyes. How about you, Alexander? What's your dream?
Slightly different. I would like, it's all about autonomy. Patients, everybody, not just patients, we all like to feel in control of our destiny. Yeah. And I would like to feel more opportunity to have a bigger say in their care.
Yeah.
I think some of the dreams, it's an infinite regress. As you make one step forward, you always want more. You'll never have enough healthcare. You always want to insert the fountain of eternal youth when no disease ever occurs. That's unfortunately not going to happen. But I think people's sense of well-being would like to feel in control.
Yeah.
So if we can return some measure of control, then I'll be happy.
Yeah, marvelous. And then Stephanie, I suppose I'm interested, you know, you're clearly passionate as an organization about eye health. So what is your dream with this?
My dream, I think, combines what Susan and Alex have already spoken about, which is identifying disease early, putting that in the hands of patients so that, you know, you don't have to feel anxiety when you go to an appointment, because you already know, this is what my vision is doing. I'm going to have a conversation with my eye professional, and, you know, I feel more informed going into that conversation. I've had my small questions answered, so therefore we can have a conversation about what that big question is, about my treatment plan. My dream is that if the doctor says, right, we're going to use this new treatment, that maybe you already have a little bit of information on what that is. This technology is about really trying to help our eye doctors, as well as helping people who live with an eye condition. And I think, you know, that's how I can see, you know, if we can make as many of our patients and people who live with eye conditions experts, then that means that people are going to get better outcomes, so that you have the confidence to raise your hand and go, hey, do you know what, I think there's a problem. And we've already had a couple of cases where, you know, patients said, look, hang on, something's changing on this, and then they've got in touch with their eye professional. And we've been able to act earlier because of that. And that's the kind of thing that we really want. And Dave made a really good point in the chat about, you know what, my contrast sensitivity is really impacted. And I get this letter back, but I really want my eye professional to know that it's impacted. And I think having that conversation, so when you see maybe a new eye professional for the first time, you as someone who lives with an eye condition can say, here is how my vision is impacted, and I have data that I can share with you on how I see the world.
Yeah, we somebody just put in about dark shadows. We are increasingly saying to people, just do the one eye shut, the next eye shut, because we know the brain will overcompensate. So if you do nothing else, try and look at a straight line and just close one eye after the other, and that will start to tell you if there's anything you need to worry about. But also go to the optician. Pranay, I'm interested. Has looking at and crunching the data given you anything you've been surprised by in doing this? Has anything kind of gone, oh, wasn't expecting that, to see that in the data?
Yeah, I guess I guess the really exciting thing is just how we are able to pick so many of these things up straight away. So people play the games over time, and especially with our distortion game mode, like reaction time and some of the other things around the game scores that aren't just related to how people are playing the games, are actually showing, the preliminary results are showing there is some sort of I guess signal that something's changing, which is really exciting. It's like guess really going into those games and all of the different ways that we can sort of crunch the data is really exciting. And I think it's surprising how many different directions we can go with it. And we're, as I mentioned, we've got a team of data scientists and machine learning engineers, AI people, who are sort of looking at all of those different ways to make sure we can sort of get the best results. So just sort of watch this space. It's really sort of exciting times.
And how important has been having some of that OCT scanner data? You know, we're increasingly saying to people, you know, and as an organization, for all of our staff, we ensure that every member of staff who has a free eye test also has an OCT scan. You know, how important is it that we keep getting people to go and have OCT scans?
Yeah, especially on this study, that's basically how we are understanding what our clinical ground truth is. So how is patient's eye health? We're using those OCT scans to sort of determine, you know, does the eye health look objectively, you know, better, worse, based on last time? And then we're using, you know, the other complementary methods of have people had surgeries? Have people been diagnosed with a new eye condition? And all of those things sort of put together have really helped us train what we're building in the best way. So yeah, getting those OCTs are really great and really important.
Yeah, brilliant. So how do people join? If they fill the criteria, are you able to put that email address back in the chat again, so as we can share that with everybody? Because I think there's an awful lot of people on this call who are desperate to join, and I have to say, I think they look so simple, the game. I think that's what's so impressive about this, is actually it looks so simple and yet so effective. And you know, we know for a lot of people, it actually, I want something that's really easy to use. You know, don't give me something that's super complicated, because actually I'm going to really struggle with using that. So the fact that it looks so simple looks absolutely excellent. So yeah. If anybody else has any urgent questions they want to ask, put them in the chat. So Stephanie, what happens next with the study?
Well, I was just going to say, if you've got any tough questions for Professor Downs and Professor Foss, now is your time, because I feel like they've got off too lightly. And you've got two real experts in the room here to answer your questions. So what happens next? So we are analysing data. And as Alex said, we want to find out for whom does the data from the app correspond to the data that we get in appointments. And so therefore, who is the app useful for? And then where does that data not align, and what does that tell us? So we want to know that. And then, so the next steps would be also, and there's been a few notes about this in the chat as well, but creating an automatic flag. Because at the moment, this app simply collects data and it allows that data to be viewed over time. The app currently does not give an alert as to when the vision's deteriorating, but we know that that's really important as a next step. And that's really important to people who live with eye conditions who use our app, but it's also really important to our eye professionals, because that's the bit that's going to really make the difference. And so that's what our whole team at OKKO is working on, together with our hospitals and with the Macular Society, because it's not just about creating that alert. In fact, that's what the whole AI project is about. It's about saying, how should that alert be presented? Who should it be presented to? And there's lots of things, both in terms of that needs an upgrade. So it's a medical device at the moment, a software medical device that will require an upgrade when that is ready. That means there's even more safety wrapped around, and it means we go through procedures. But also, we need to make sure that that fits into the hospital systems as well.
Yes.
In the relevant countries. And also there are medical legal things. There's a whole bunch of interesting stuff. But as a team, we're determined to tackle that together because we know how important this next step is.
Yeah. It feels like that's the kind of next step, isn't it, in making this a really holistic, that actually you'd want then to have something that was triggered that meant the patient could go, right, actually the app has spotted this, I've now had my letter from I need to go back and see, that the clinician can see what it is that the app that's picked up, and that you get that really good broad view. And there's somebody has put in, there's a study that came out a couple of days ago about dementia, saying that they think I'm going to word this wrongly, I'm going to sound like an idiot, but there seems to be a link between sight changes and aging and a predictor of dementia. And I don't think we've seen any evidence that I'm aware of around AMD and dementia risk, but it will be interesting to see what that study discovers further in terms of what is happening in eyes and what that then means for dementia. So there's a lot still, isn't there, we don't know, but that we know that there are more people getting diagnosed with AMD. We know we need to get to people much earlier. We want to be able to stop them losing their sight, and that actually this feels like a big part of that big picture in terms of supporting everybody with AMD and the potentially other sight loss conditions. So it's really exciting. It's really exciting. And thank you all so much for working on it, being so passionate about it, for sharing all of that with everybody here this evening. For anybody who's interested, there was a story on our website a week or so ago regarding the progress on the study. So if you want to read a little bit more, go to our website, macularsociety.org. And I think there's some of the details as to how you can join as well in that article. So so everybody, thank you so much. I love doing these. I learn so much. So we are not having a My Macular and Me in September, because instead we have our Hope for the Future conference, which is on Saturday the 14th of September, which is free to anybody to join. There's a session on inherited macular conditions. There's a session called My Macular and Me, which is all about if you have people who are caring for you or family members who don't really understand and they want to know more, there's a session for them. And then the afternoon session on that Saturday is all about the latest research in AMD. So if you want to join us on the 14th of September, you can register, join on the day, or register and listen again afterwards. Just go to our website, macularsociety.org. But we hope you found this interesting and helpful. Thank you so much to all of our speakers. Thank you.